Gurmagat Las Ciancórla. I'd like to thank you and the House for the opportunity to update colleagues on the Government's response to the rollout of the national vaccination programme and the ongoing COVID-19 pandemic. On Tuesday, Government announced a plan that we all hope will be a permanent path out of this pandemic. Because people have backed the Level 5 measures to date, the measures advised by NPHET, by the public health doctors, Ireland now has one of the lowest COVID rates in Europe, while other countries are very sadly having to impose new lockdowns. In Ireland, we're having a national conversation about a cautious but a steady path out of the pandemic. The progress made in fighting COVID has been hard won by every person and by every household across the nation playing their part. We need to protect that progress and protect the progress of having what could be a really good summer. For that to happen, the advice from NPHET is absolutely clear. It's that as a nation, we need to keep the virus down for that bit longer. The analysis from NPHET shows that every week we can do this makes a big difference. Every week we do this makes it possible to consider more and better options for the summer. Every week we do this gives time for enough people, particularly those most vulnerable to COVID, to be vaccinated. As the Acting Chief Medical Officer has said this week, the next 6 to 8 weeks are vital. To that end, Las Ciancórla, I'd like to thank colleagues in the House, right across the House, for their broad support of the measures that were announced this week. Many of our neighbours in Europe are suffering brutal resurgences of COVID-19 right now. Some are experiencing a very real shortage of hospital beds, including critical care beds. So can I take this opportunity as well to ask colleagues right across the political spectrum for their help in engaging with people to reinforce this important message. While the end may be in sight, and we hope it is in sight, the COVID situation here in Ireland is still highly volatile. Another surge would take very little to happen, and so it is as important as ever, possibly even more important than ever, for us to stick with the measures in place for that bit longer. On a positive note, I was glad to see on Tuesday evening the total number of confirmed COVID-19 cases in hospitals has dropped below 300 to 290, and that was for the first time this year. Our national vaccination programme is a huge achievement, and it represents our best line of defence within our ongoing comprehensive public health programme. Our national vaccination programme will not replace our existing public health guidelines in the short term, but it will allow us all to resume a sense of normality in the future.
I beg your pardon?
They're outside.
Okay.
They keep them outside now.
They're usually outside.
But they weren't there from
yeah, thank you. Sorry, Minister.
No point in putting them outside after you start.
They were put outside, Deputy, before I started. They were there before the session started. Will I resume, Las Ciancórla? Thank you. Today in Ireland, nearly 1 in 6 adults have now been vaccinated, and we are prioritising the most vulnerable. COVID-19 infections in the long-term care facilities, among healthcare workers and in those aged 85 and older have fallen dramatically. We cannot begin to fathom being in this position 12 months ago. Vaccination has prioritised those with underlying medical conditions that place them at very high or high risk of medical negative consequences, severe illness or death should they contract COVID-19. On Tuesday, Government approved an update to the COVID-19 vaccination allocation strategy. This strategy sets out the groups to be prioritised for vaccination to best achieve the vaccination programme's objectives of preventing serious illness, hospitalisation and death. It is based on clinical, scientific and ethical frameworks and evidence produced by the National Immunisation Advisory Committee and by my department. The evidence is unequivocal that risk of hospitalisation and death increases with age, while a review conducted by NIAC found that the only occupation or sector showing a significant increase in risk from COVID is healthcare. The evidence from NIAC about the risk of severe outcomes based on age is clear, and it's very stark. Comparing someone aged 20 to 34 to someone aged 50 to 54, the 50 to 54-year-old is 3 times more likely to be hospitalised, they're 10 times more likely to end up in intensive care, and they're 15 times more likely to die from COVID. If we compare someone aged 20 to 34 with someone aged 60 to 64, which will be the first, part of the first new age cohort, the person aged 60 to 64 is 5 times more likely to be hospitalised, they're more than 20 times more likely to end up in intensive care, and they're more than 70 times more likely to die. Given the huge extra risk associated with age, government decided to accept NIAC and NEFIT's recommendations. This approach will maximise the benefit of the vaccination programme, minimise serious illness and death, reduce Ireland's risk to COVID as quickly as possible, and in so doing, allow Ireland to open up as quickly as possible. Our vaccination programme has already had a big impact on reducing the high levels of hospitalisation due to COVID. The data clearly shows the impact vaccinations are having. It's hugely encouraging. The available epidemiological data shows a spectacular fall in the number of cases among those aged over 85, with experts expecting that downward trend to continue as we proceed with the vaccination of all those aged 70 and older. As the volume of vaccinated people increases, the incidence of disease in our community will fall. One of the greatest successes of the programme to date is for those living in nursing homes. Our nursing homes were amongst the most vulnerable settings to this virus. In January, we averaged 38 outbreaks a week in nursing homes. In the last 4 weeks, we averaged 2 outbreaks a week. That's a huge drop. Nursing home residents and staff were among the first to be vaccinated. Serial testing for COVID in nursing home is now showing a positivity rate of less than 0.2%. Healthcare workers and people in long-term residential care now make up 3% and 1% of all new cases, respectively. That 3% and 1% compared to 16% and 15% at the end of January. We've started to see the benefits of vaccines for our friends and our families. By making nursing homes safe again, visits resumed in many facilities from March 22nd. Now, the new advice for those who are fully vaccinated will also provide additional relief to those that have in many ways been impacted the most by this pandemic. 4 safe and effective vaccines have now been approved for use in Ireland. Ireland has secured allocations for approximately 18 million doses of vaccine overall. The single-dose Janssen vaccine, recently approved by the EMA, will be the 4th vaccine available for use in Ireland, making up around 15% of total vaccines in April, May and June, if, as always, deliveries arrive as scheduled. There will be further progress in the vaccine rollout. Over the next 3 months, between April to the end of July, we expect to receive over 3 times the numbers, to the end of June, we expect to receive over 3 times the number of vaccines we received over the first 3 months of the year. We expect to receive an average of 1 million vaccines a month during this quarter, dependent on the ability of manufacturers to deliver consistent, ongoing supply, as always. We have a plan. We are making rapid progress towards the finishing line. As we proceed, we will continue to pursue our core priorities, which are to protect our most vulnerable, to enable the safe return to education and childcare, and to protect our health and social care services. The next few months can be transformative in our response to COVID-19. Thank you, Lascian Corla.